Are my H. pylori symptoms still present after treatment? If you've recently finished treatment to get rid of Helicobacter pylori, you might wonder if lingering symptoms mean the infection is still there. It's common for some symptoms like stomach pain, bloating, nausea, or feeling full early to stick around even after successful treatment. But this doesn't always mean the bacteria are still present. Sometimes, these symptoms are caused by ongoing inflammation in the stomach lining or other stomach conditions that aren't directly related to active infection. Research shows that even more than 5 years after confirmed eradication, about 20% of patients still have mild inflammation in the stomach. Also, around 1/3 of people may still have elevated antibodies against H. pylori, which can stay in the blood even after the bacteria are gone. This means that immune markers and mild inflammation can remain without the infection being active anymore. To know for sure if the bacteria are gone, healthcare providers usually recommend testing at least for weeks after treatment using non-invasive methods like the urea breath test or stool antigen test. Testing too soon or while taking acid-suppressing medications can give false results, so timing is important. If symptoms continue despite confirmed eradication, it's important to get further evaluation. Persistent symptoms might mean that H. pylori was never the main cause, or that other issues like peptic ulcers, gastritis, or functional dyspepsia are involved. Sometimes, an endoscopy is needed to look inside the stomach and check for other problems, especially since chronic H. pylori infection can increase the risk of stomach cancer. It's also worth noting that if the infection was not fully cleared, symptoms may persist because the bacteria are still present. In such cases, doctors may recommend alternative antibiotic regimens tailored to previous treatments and local resistance patterns to improve the chances of success. Understanding the connection between H. pylori and stomach cancer is important. Persistent infection and ongoing inflammation are known risk factors for developing gastric cancer. That's why confirming eradication and managing any ongoing gastric inflammation are key steps in reducing this risk. Even after successful treatment, some people may need regular monitoring if signs of chronic gastritis or precancerous changes remain. In summary, if you still have symptoms after treatment, it doesn't necessarily mean the infection is still active. It could be residual inflammation or other digestive issues. Confirming eradication with proper testing is essential. If symptoms persist, it's best to see a healthcare professional for further assessment. They can help determine if other conditions are involved and guide appropriate treatment. Always remember that individual experiences vary, and personalized medical advice is the safest way to address ongoing symptoms and reduce long-term health risks.